Hi everyone, and welcome to Radiation 101. This is Stacey Goslin. I am presenting my Radiation 101 course that I used Google Sites for the Instructional Design 655 course with Rebecca Hogue. I hope you enjoy my presentation. My home screen says, the name of my course, and then I have a voice thread that
Hi everyone, and welcome to Radiology 101.
That introduces myself and the objectives of the course and what you will be learning along the way. As you scroll down the page, you'll see a brief overview of the course. We're divided into 3 modules. Module 1 being what is radiation, Module 2 being the history of radiation, and Module 3 being radiation doses and imaging. So if you click on the What is Radiation button, it will then redirect you to the Module 1, I hope. And in this module, again, you will learn what radiation is. The learning objective is to define radiation and recognize the various types of natural and man-made. My power toon depicts the different types of radiation, how they're man-made, and there is natural radiation that we're all exposed to on a yearly basis, and how our yearly dose is 6.3 millisieverts. Of cosmic and terrestrial radiation and radon, and man-made. Man-made takes up about 50% of our radiation allowance for the year. I then talk about the different sources of radiation and how when you hear about man-made radiation and CAT scan and X-ray and nuclear medicine and mammography, that I want you to recognize that ultrasound and MRI is not a ionizing radiation, so it doesn't contribute to that 6.3 millisievert dose. And then I have here a little professional development of Two Truths and a Lie. It talks about radiation, and it gives you 3 statements. 2 of the statements are very true, and 1 of the statements is not. For example, all the American flags placed on the moon are now red due to the radiation from the sun. That's the first statement. The second statement: after radium was discovered by Marie Curie, who died of radiation, people used it for things like condoms, candy, toothpaste, health tonics. One man drank 1,400 bottles of it before his jaw fell off. Then the third being bananas are slightly radioactive, and eating a banana exposes a person to radiation. Recent post-earthquake radiation spikes in Japan measured in bananas have seen levels of up to 30 bananas, but have dropped down to 1 to 2 bananas per day. Which of those 3 statements is false? That would be that all the American flags on the moon are now red due to the sun. It is very false. All the American flags are now white due to the radiation of the sun. Which means the other 2 statements were very true about the man's jaw falling off and with radioactive bananas. And then we go on to a little bit of radiation biology. The average smoker receives an annual dose of radiation equivalent to 3,000 chest x-rays due to the radioactive isotopes in the smoke. The Manhattan Project tested the effects of radiation on citizens in some pretty outlandish ways, including feeding babies with radioactive oatmeal. And Vladimir Pavlik was a firefighter who responded to the blast at Chernobyl, and it said that his eyes turned from brown to blue because of the radiation. Those 3 statements, which of those statements is false? It's actually the first statement. The average smoker receives an annual dose of 300 chest x-rays, not 3,000, which then again means the other 2 statements about the Manhattan Project and feeding radioactive oatmeal to babies and the firefighter's eyes turning from brown to blue were very true. As we move on to the next module, which is about the history of X-ray, I talk a little bit about in my easel here about the progression of it. Radiation was discovered. X-ray was discovered in 1895 by Willem Conrad Röntgen. The first X-ray ever done took 15 minutes, and it was of his wife's hand. The image is on the left of the flag. It was obviously his wife's left hand because that's her wedding ring. He named it X-ray after the algebraic X for unknown because he didn't know where this ray came from. So he named it X-ray. And as you follow up the easel, there are more discoveries. Henry Becquerel discovers radioactivity. And then you have William Röntgen receiving the Nobel Peace Prize in Physics. And then you have the field that I'm in, X-ray techs, finally coming and being appointed in 1903. And then as you move further up, you have the first MRI. The first clinical use of MRI was in 1967. Close to, 70 years after the first X-ray was ever made, we now have MRI. And these two images, no matter how far apart they were discovered, are still work together as a team to help diagnose patients. And then as you go down to the bottom, I do a little bit of testing your knowledge with the different histories. And then module 3, I talk about radiation doses and imaging. The learning objective for this module is define radiation doses and the syndrome associated with the various levels of radiation exposure. And recognizing the different modalities in their radiation equivalents. Radiation dose is not like medicine. Dose of radiation is not the same as the dose of medication. Radiation dose has many forms, and it includes absorbed dose, equivalent dose, effective dose, and these several quantities in these doses measure in milligray, which is when we talk about absorbed dose, and millisieverts when we talk about dose to the X-ray tech or to the public. The concept of radiation dose may be confusing, and you and your radiologist or medical physicist should work together to answer the questions you have about radiation doses. My first multimedia is a quick little YouTube video about absorbed dose, equivalent dose, and effective dose, and what the difference is. If it plays.
Radiation is measured in 3 different ways: absorbed dose, equivalent dose, and effective dose. Absorbed dose is the concentration of energy deposited in a tissue as a result of an exposure of ionizing radiation. X-rays, unlike sunlight, can penetrate deep into the body and deposit energy in internal organs. X-rays can even pass through a person's body, which is how we actually get the X-rays that you and I both look at. The unit of measurement for absorbed dose is milligray, or mgy. Equivalent dose is the amount of energy that it takes to damage the properties of different types of radiation into account. For instance, the difference between equivalent dose and absorbed dose is absorbed dose tells us the energy deposited in a small volume of tissue. Equivalent dose addresses the impact that type of radiation has on the tissue. Effective dose is the last. It is a calculated value. It's measured in millisieverts, MSV. It takes 3 factors into account: absorbed dose of all the organs of the body, the relative harm level of the radiation, and the sensitivity of each organ in the radiation field.
And as we continue down the page, you'll see the radiation doses in imaging and the amount of radiation associated with certain radiation disasters, nuclear plant disasters. So as you look, first 10,000 millisieverts is the person would be fatal within weeks. 6,000 millisieverts is typical Chernobyl worker with death resulting. 5,000 millisieverts are doses required to kill half of the population within a month. 1,000 millisieverts causes radiation sickness. 400 millisieverts was the Japan plant accident. Those are the radiation levels. And then you have 100 millisieverts is the recommended radiation dose every 500 years. And 350 millisieverts is the exposure of Chernobyl residents. Radiation levels at these numbers really only come into account when there's a nuclear power plant accident or some kind of nuclear accident. The x-rays coming out of x-ray rooms or in nuclear medicine or in radiation therapy, yes, are very high, but never come close to this amount of this radiation. And then to fulfill my learning objectives, I talked about acute radiation syndrome, which is divided into three main presentations: hematopoietic, gastrointestinal, and neurological and vascular. As the radiation doses increase, you move along to the different levels of the acute radiation syndrome, neurological and vascular being the worst of the syndrome. I then talked about the different modalities associated in radiation, how there's radiography, mammography, and nuclear medicine. I do have a modalities PowerPoint here, but it's fairly long. It won't make it to my 15-minute hard stop. And then my last presentation is the radiation doses in imaging. A lot of people and my patients ask, is this safe? Should I be having this done? And I ultimately say it's a benefit versus the risk. Do you want to know what's wrong? Do you want to know why you feel sick? Do you want to know if this bone is broken? Then if you want to know, then the benefit outweighs the risk. But I did put together a little visual aid to associate how much radiation the patient receives and what that is equivalent to in our yearly background radiation dose. So as you can see, a full body CT from head to toe is a 10 millisievert dose, which is equivalent to 3 years of natural background radiation. The highest of all of these being a positron emission tomography, which is actually what they call a PET scan, and that is equivalent to 8 years of natural background radiation. And that concludes the end of my presentation. I hope you enjoyed it. I hope it was informational, and good luck with the rest of the semester. Bye.